Welcome to A Deadly Silence. I'm your host, Larry Curtis, and it is the goal of all of us here at A Deadly Silence to bring to you current and educational information surrounding the issues of alcohol and drug addiction. Today, we're honored to have with us Dr. John Kelly. Dr. Kelly is an Associate Director for the Center of Addiction Medicine at Massachusetts General Hospital. He's also an addiction specialist and a clinical psychologist, as well as Director for Addiction Recovery Management Services and an Associate Professor of Psychiatry at Harvard Medical School. Dr. Kelly, welcome to our program.
My pleasure. Glad to be here.
There. Our program has a focus today on alcohol addiction and all the different aspects of what not only the addict but even the family and loved ones go through. Before we start, tell us a little bit about yourself and how you got into this type of a program.
Well, I've been in the field for more than 20 years now studying. I started as an addiction counselor and then got involved in psychological research around addiction and treatment services. So I'm a clinician, a clinical psychologist, addiction counselor, and researcher, and increasingly kind of getting more involved in the policy arena as well around policies for effective intervention and recovery supports for people in recovery with addiction problems. And so I've been doing research now for the past 10 years really, focusing on what are the active ingredients of treatment, what are the effective treatments, and what do we need to help people maintain recovery over the long term.
And does this research kind of focus on the results, both positive and negative, of the different aspects or types of treatment that are out there?
Yeah, we evaluate myself and many other people around the country, do a lot of evaluation on what are the effective treatments and how can those treatments be best delivered to the maximum number of people to make a big public health impact.
Now, how did the center come about being over at Mass General Hospital? Is this a collaborative effort on the part of Mass General Hospital, Partners Healthcare, or in the Harvard Medical School?
Yeah, it was recognized a number of years ago now, probably 7 or 8 years ago, within the Department of Psychiatry at Massachusetts General Hospital, that there was a desperate need to dedicate more resources towards addiction services and addiction research and increase the emphasis on in the Department of Psychiatry. And so they've done a fantastic job of really emphasizing that over the last 7 or 8 years, and which I'm been very fortunate to play a part in and help build that up and grow it. And I think just in terms of their recognition, it's been in the last 20 to 30 years, it's really started to take center stage. We know now, for example, that the misuse of substances, alcohol and other drugs, is our nation's #1 public health problem. So I think with increasing recognition overall, I think it's under the purview of more and more broader emphases within healthcare to direct more resources to focusing on addiction, and especially within psychiatry, because there's such a high rate of comorbidity between substance use disorder and other kinds of psychiatric disorder. So it makes a lot of sense.
When we talk about the abuse of alcohol and drugs and so forth of that nature, are you finding that it's specifically an alcohol addict, or is it a drug addict, or are we seeing both alcohol and drugs being used at the same time?
Mm-hmm. Well, you do see, depending on what stage of life stage you're looking at across the lifespan, with younger people you tend to see, and with more recent cohorts, with more younger people who are born today as opposed to born 30, 40, 50 years ago, you see more of a mix just because there's more prevalence of other kinds of drug availability. Opiates, cocaine, marijuana is much more available nowadays than it was 50 years ago, for example. And young people in particular are using a mixture of different substances. Alcohol is always there, 98% of the time. They're going to be using alcohol and other drugs. As you look across the lifespan in older age groups, in the mid-20s and onwards, alcohol starts to become the major substance of addiction. We have about 23 million people in the United States today who meet criteria for a substance use disorder. of those 23 million people, about 19 or 20 million meet for alcohol addiction. About 2 million meet for both alcohol and other drug addiction, and the others meet for just pure drug addiction without alcohol addiction. So as you can see, the majority of all those people who meet for substance use disorder meet for alcohol dependence or alcohol addiction.
That's in the case why Alcoholics Anonymous is one of the largest rehabilitating type programs out there across the country today.
Yeah, Alcoholics Anonymous, for example, which is the most commonly sought source of help for alcohol-related problems in the United States, has about double the number of people attending that than formal treatment. It's about 5 million people each year are attending AA, and there's about 1 million, 1.2 million regular members of AA. It's a big resource because it's a big problem.
Is there any way that you would be able to describe like the nature of alcoholism? Say whether possibly somebody in your family you believe might be gearing toward being an alcoholic. Are there symptoms, signs? What would you characterize those type of symptoms?
Yeah. Well, one of them is the importance or the salience of alcohol in their lives. It is that people tend to to value alcohol much more than other people who might enjoy a drink, but for that person who becomes addicted to alcohol, one of the early signs is that they tend to talk about it a lot, they tend to plan it, they tend to, if there's a conversation around dinner plans or other kinds of plans, alcohol is always a part of the mixture. They may bring it up to talk about it, to make sure that alcohol is present, maybe in a kind of a convivial, joking way, but in their mind, it's a very important piece of what's going on in any given day. So there's a lot of preoccupation which may manifest itself from the observer's standpoint, from a family member's standpoint as, wow, this person really likes alcohol. There's a kind of a recognition, this person really, alcohol is very important in their life. And that's kind of an early
indication,
observable warning sign that it may be playing a more significant role and getting its hooks into someone's brain and starts to change their brain.
And what has the research shown that, you know, as this person becomes addicted, you know, and the symptoms that they start to show about it? I mean, obviously they want to crave the alcohol, I'm assuming. You know, what's the clinical side of that, you know, from the standpoint of the alcoholic?
Well, I mean, from the there are a set of criteria for addiction, which originally actually comes from alcohol addiction, because that was the one that's was studied the most. And typically, people tend to drink larger and larger amounts. So you may not always see that, however, because the person may hide it. But you may wonder, for example, why is this person intoxicated? They've only drank 3 drinks that I've seen. So there can be, but if you are able to see that, you might see people gulping drinks down or drinking very heavily. That tends to increase, and that's called tolerance, because people's your brain adapts to the presence of a drug, and you need to drink more to get the same effect as you used to at a smaller dose. So certainly drinking more intensively and also drinking more frequently is another one. So people tend to want to drink more and more frequently over time. Not everybody, because there are different patterns, but certainly the typical pattern for alcohol addiction is that people will start to use more alcohol, more intensively, and over longer periods of time when they do drink.
And the body builds a tolerance up to this, so that, as you say, all of a sudden you recognize somebody may have been drinking multiple hours, many drinks, but their body is tolerating that. Is it a craving?
It is.
It is a craving.
Well, it's really, tolerance is really a function of how our bodies adjust to experience. So all of our bodies are set up to adjust to whatever experiences come our way, right? For example, if you are, if you're doing a lot of manual work, say you're working out in the garden all summer long and you're digging holes and you're using a shovel, your body adapts by creating hard skin, right? Calluses on your hands. So your hands become less sensitive, right? So it's less sensitive to the hard labor, as it were, of digging with a shovel or whatever the spade as you're doing your gardening. And so your hands become, your body says, wait a minute, I'm doing a lot of work here, let's build up this thing because it's creating blisters, we need to make some tough skin there, and your body just naturally adapts and adjusts to it. You build muscles up while you're doing that as well. So in the same way as our hands become less sensitive to the effect of that shovel and the digging, our brains become less sensitive to exposure to alcohol or any drug that's input into the body. In the same way as the body is just reacting to experience. So if it's saying, I'm getting too much of this receptor being released in the brain in the case of a drug, then I need to do something to it. The brain says I need to do something to adjust to that. So in a sense, it becomes less sensitive, just like your hands would become less sensitive by producing a callus of skin. The brain becomes less sensitive to the effects. So what do we want to do? We want to turn up the volume a little bit more so you can hear that, get that signal, because it's less sensitive.
In the course of treatment, what are some of the standard treatments that a family member would want to know about if somebody was an alcoholic in their family?
Well, there are a number of different behavioral and pharmacological treatments available today for alcohol addiction. There are very good behavioral treatments, cognitive behavioral therapy. There's also behavioral couples therapy, which actually was developed, a large part was developed here in Brockton at the Veterans Administration for couples who have alcohol dependence. One person has an alcohol dependence problem.
So that's a program that was founded here in the VA in Brockton.
It was developed.
And, one of the spouses had an alcoholic addiction issue,
yes.
And they were together trying to find some treatment.
Exactly,
Okay.
and they developed a treatment specifically for couples to help bring support for the so-called identified patient, as it were, the person with the addiction problem, have their spouse come in and they do a couples therapy together. That's shown to be very effective. Cognitive behavioral therapy, again, is a very, broadly speaking, a structured therapy that focuses on avoiding high-risk situations, people, places, and things associated with drinking patterns, to reduce the exposure to those situations, to help people restructure their thinking about themselves, about their day, and avoid exposure to cues. And the social network, ideally to change their social network, which is a big influence on their drinking. There are also 3 FDA-approved medications for alcohol dependence. One is disulfiram, so-called antabuse, which blocks the metabolism of alcohol and produces very bad effects if you drink alcohol. And that's one medication that's been approved for a long time, actually, since 1947 that came about. So that's a long-standing treatment. It's only shown to be effective, however, when you have a spouse involved, ideally, when you have someone who can help you monitor the medication, because people tend to be non-compliant with it.
Right. Mm-hmm.
And a couple of other medications. One is acamprosate, which is a type of medication which lowers or attenuates the what they call post-acute withdrawal effects from alcohol dependence. So when people are acutely stabilized from alcohol, they sometimes have ongoing cravings, which is produced by a certain part of the brain. The glutamate system in the brain has a hyperactive response. And acamprosate helps attenuate that response. So people feel a little calmer and their cravings tend to diminish. So that's one. Another one is one called naltrexone, which is actually an opiate antagonist, which is used in Narcan, for example, because it blocks the effects in the mu-opioid receptor. It antagonizes, it blocks that receptor. So you can't get the effect, for example, from opiates, but it's also approved as a medication for alcohol dependence, because alcohol also affects the opioid receptors in the brain. And that is the kind of the mediator through which alcohol produces pleasure in the brain. So there's those 3, and there's an injectable form of naltrexone called Vivitrol, which is a once-a-month injection, which is used for alcohol dependence and also used for opiate addiction.
You mentioned earlier, touching on the kind of the family support when maybe this medication, some of this medication may be available. How important is the family, and what have you found in your research of supporting the addict in that case?
Yeah, well, family support is always extremely helpful, as has been shown in these couples counseling therapy, for example. in terms of if you have a spouse, not everybody, sometimes the spouses are long gone by the time they end up in treatment as a function of their illness, but if they do have a spouse who is supportive and can lend support, it can be extremely effective. In fact, it's the most effective treatment that we have is couples therapy. So that's specifically involving the spouse. And there's also family therapy, which is involving the whole family, which is shown also to be effective as a treatment for alcohol dependence, alcohol addiction. But more generally, outside of those more formal treatments, treatment regimens, involving the family is very important to provide understanding, educate the family, not just about what addiction is, but also what to expect in recovery. Because oftentimes, family members are very, very concerned about what to say, what am I going to say, what am I going to do when my loved one comes out of their treatment facility. How much, and they have this sense of walking on eggshells. They're not sure exactly what to do and what to say. And if I say this, maybe my loved one will pick up a drink or relapse. So providing, getting support for family members, helping educate them and provide knowledge about what to expect down the road. That can also be gotten from groups, community groups, of course, like Al-Anon has been around for a long time, which provide, again, that resource for free in the community. And just like the individual themselves, who's the primary person who's addicted, it's helpful for family members to get ongoing support in that way too, because it is an addiction to alcohol or another drug is susceptible to relapse over the long term. The good news is that most people with alcohol addiction and other drug addiction do recover. About 60% of people who meet criteria for addiction actually make full sustained recoveries. That's the good news. But it can be a bumpy road for people to get there.
There's a saying out there that the road to recovery is you're going to relapse time and again, potentially out there.
Some people do, yeah.
Right.
Not everybody, but certainly that's a more typical course of recovery, is that people, when they're trying to stop, it's a learning, you think about it as a learning process where people are finding out what they can and cannot do in order to stay in recovery. And that's a process of experiential learning with treatment and support along the way.
Let's kind of step back a little bit and talk about the multidisciplinary team approach that your program is bringing to the addiction issue out there. Can you shed some light on that for us?
Yeah. I think it's we've broadened our scope in terms of we no longer have a reductionistic approach with complex disorders. And addiction, like other psychiatric illnesses, is a complex disorder. That means it's not just a function of giving someone a pill or giving someone an injection and that's going to set them right. It's not like you can cure it with an antibiotic. You really need to attend to the multifaceted nature of it, the biopsychosocial aspects of the illness, so-called. So there are biological aspects, there are psychological aspects and social aspects, and some would say also spiritual aspects. And so from the biological aspects, it's very important to make sure that someone is medically stabilized. So for example, with alcohol addiction, there is a risk of heart attack through the rebound effect when people go into withdrawal from alcohol, and that can be life-threatening. So it's very important for people to understand, to monitor that and manage that if necessary through providing a medication and monitoring the vital signs to make sure someone is stably withdrawn from alcohol with low risk. That would be the kind of the biological component. And then you have the psychosocial aspects, which is really about helping people to learn more about the nature of their own illness, educate them about that, but also importantly, to be able to get into action and do the things necessary, as I mentioned before, that will facilitate beginning recovery and then maintaining recovery over time. And these are the kinds of things that I mentioned in terms of avoiding people, places, and things. Maybe changing your social network, changing what you do, beginning new patterns of behavior, and getting support through AA, for example. AA is a very potent aspect of that recovery paradigm.
Are there any unique treatments that your program has been able to develop or offer to the addict? And is your program an inpatient or is it an outpatient?
It's outpatient. Yeah, the program, we have a number of different services at Massachusetts General Hospital. We have services for adults. We have regular outpatient services, kind of more once a week, less intensive. We have very intensive outpatient programs where people come maybe 3 times a week for several hours a day to come and get help. We have programs specifically for adolescents and young adults as well. We have programs, specifically for parents. A lot of P's there. Specifically for parents, and we have a fairly new intervention called parent coaching, which is in very high demand right now, where we have parents who are coming in sometimes without their kid. They're very worried about their child who may have an addiction problem with alcohol or another drug, but the child is not ready to come in to treatment. So we engage the parents, we coach the parents, and provide them with understanding and arm them with some strategies that they can use to help use differential, as they call it, differential rewards or differential reinforcement, and help them, empower them to influence the environment for their kid. It makes it more likely, this has been shown to make it more likely that their kid will come into treatment, as well as providing support and information for the parent. So we have that new program as part of our addiction recovery management service, which I think is very innovative and important.
And what has been the impact on the children of a parent who is an alcoholic? How does the other parent basically deal with that whole psychological aspect of it? From the children's point of view.
Yeah. The children grow up in family with an alcoholic parent usually has higher levels of psychological distress because of the chaos and the unpredictability that goes along with somebody who's addicted. And that can have it's variable in terms of the response, and there's individual variability in how much, different kids, even within the same family, may be affected depending on when they're born and so on, and when the mother or father developed the addiction problem. But on average, if you average across all that, and you compare those to families who don't have an alcoholic parent in the family, then they tend to have more distress and more difficulties adjusting. They're also at higher risk through heritable risk, have a higher fourfold increased risk of developing alcohol addiction themselves, probably mediated through a genetic predisposition.
How is your particular clinic unique from maybe these other programs that might be out there? Is there anything that sets you apart?
Yeah, well, one of the things that sets us apart is the focus on long-term. We have a long-term philosophy of addiction recovery. So the whole notion of recovery management, and I just published a book actually with Bill White on addiction recovery management, which is the first book in the field in that area, which really talks about the philosophy of addiction recovery management, viewing it as a chronic illness, treating it as a chronic illness, which means really being in it for the long term, making sure that we provide assertive linkages for individuals who come into the program. So we don't graduate people after 20 days or 30 days or 50 days. We keep them involved. We use innovative methods to try and help young people keep engaged and get engaged with us, use texting, the kind of modalities that young people are more likely to use today. And the parent piece, I think, is very important. And I think that's the parent coaching piece is an innovative strategy used to help the young person get involved in treatment and also to keep them there. But also focus on parents in their own right. I think there's a case of international neglect when it comes to parents and family members of addicted individuals. They don't get the kind of help that they need. And I think providing that is important.
I think that's a common denominator that any parent who is having to deal with an addict of whatever alcohol or drugs is that there's a sense of loneliness or abandonment that they just can't figure out where to turn. Who should I turn to? Where do I turn to get that help? Yeah. That being said, how do you target or identify people for your program? You know, I mean, are you going out looking? Is somebody able to go to the hospital and be referred, or how does that happen?
Both, in many ways. There's kind of in-reach, as it were, outreach in terms of out into the community through advertising, and just getting the word out that we have a program that's focused, have these specific emphases on addiction recovery management, and specifically for young people. That's really our focus right now within that service that I'm involved in, the addiction recovery management service. We have other services which for regular adults can provide those other services. And then we have in-reach, as you alluded to, which is within our own system, is through the emergency room, for example, identifying candidates through, you know, that might be in need of more intensive services through the emergency room, and through the psychiatric emergency version of the emergency room. People coming in with severe acute psychiatric distress that have an addiction problem that may be exacerbating their psychiatric disorder, or vice versa, and we get folks referred to us that way.
Now, how is funding allocated? I mean, is this a grant program? Is it, you know, how does that take place, and what would be expected of one of the patients, you know, from the standpoint of compensation for whatever's taking place?
Yeah, all of our services are covered by insurance, depending on your insurance, including Mass Health. So they're all covered. And we have some services are not covered, like some of the parent coaching, I think, is not covered totally, but much of it is. So that's good news. Unfortunately, we do provide services that aren't covered at all. Some people are pay out of pocket for those, and some people don't.
Is there federal, state funding also supporting the program?
No.
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 So this isn't a program that's going to disappear because of lack of revenue resources from the standpoint of the state.
No, it comes through mostly through insurance,
through
and then it's subsidized by the hospital.
From that second. Well, we're about at the end of our program right now, maybe 30 seconds. If you had one thing to say to our audience out there in relation to the alcoholic, you know, and the family, and what they need to be looking at, what would that be?
It would be, I think, communicating effectively to the person that you're concerned about at the right time, when they're in a receptive mood to hear it. I think that's very important. To bring it up, I know it can be scary to do that, but I think communicating that, offering to help them get help, providing them with information that can help them, facilitating helpful recovery-related aspects, and any steps in the right direction there will be a good move. And even seeking help for yourself, so that you, as a family member who's very concerned, can get help for yourself by calling Learn to Cope or Al-Anon or one of the other groups that can help you, or, for example, our program that can help parents if you're a parent of someone who's suffering from alcohol addiction.
Well, Dr. Kelly, I want to thank you very much for sitting here with us and sharing with us your points of view, the strengths of your program. And from all of us here at A Deadly Silence, we hope to see you next time on our next episode.